Cardiac pacing. A cardiac pacemaker is an electric device that delivers direct stimulation to the heart. The purpose of pacemaker is to initiate and maintain the heart rate when the heart's natural pacemaker is unable to do so. Pacing may be accomplished through a permanent implantable system, a temporary system with an external pulse generator and percutaneously threaded leads, or a transcutaneous external system with electrode pads placed over the chest. Pacemaker design pulse generator contains the circuitry and batteries to generate the electrical signal. Pulse generates may be temporary external or permanently implanted internal. Pulse generates are outside the body in temporary pacing systems and subcutaneously implanted in permanent systems. Temporary pacing systems are for short-term therapy. Permanent pacing systems provide for long-term therapy. Temporary external transcutaneous pacemakers are used frequently during emergency situations requiring immediate cardiac pacing. The pulse generator in a permanent pacing system is encapsulated in a metal can which protects the generator from electromagnetic interferences. A temporary pacing system generator is contained in a small box with dials for programming. The external box is attached to the patient with velcro straps. Permanent pacing systems are reliable power sources such as lithium or nuclear batteries. Lithium batteries lifespan is 8 to 12 years, and whereas nuclear power sources, although used infrequently, offer a 20-year projected lifespan. Pacemaker leads transmits the electrical signals from the pulse generator to the heart. One or two leads may be placed in the heart. A single chamber pacemaker has one lead in either the atrial or ventricular chamber. The sensing and pacing capabilities of the pacemaker are confined to the chamber where the lead is placed. Dual chamber pacemakers have two leads. One lead is in the atrium, the other lead is located in the ventricle. One unipolar or two bipolar electrodes are contained in the tip of the pacemaker, lead in contact with the heart. Transcutaneous external pacing system non-invasively delivers electrical stimuli to the heart. Pacemaker function. Cardiac pacing refers to the ability of the pacemaker to stimulate either the atrium, the ventricle, or both heart chambers in sequence and initiate electrical depolarization and cardiac contraction. Cardiac pacing is evidence on the ECG the presence of spike or pacing artifact. Pacing functions: atrial pacing, ventricular pacing, and atrioventricular pacing. Atrial pacing: direct stimulation of the right atrium producing a spike on the ECG preceding a P wave. Ventricular pacing: direct stimulation of the right or left ventricle producing a spike on the ECG preceding the QRS complex. Atrioventricular pacing: direct stimulation of the right atrium and either ventricle in sequences, mimics normal cardiac conduction, allowing the atria to contract before the ventricles. Atrial kick received by the ventricles allows for an increase in cardiac output. Sensing functions: demand ability to sense intrinsic cardiac activity and deliver a pacing stimulus only if the heart rate falls below the present rate limit. Fixed: no ability to sense intrinsic cardiac activity. The pacemaker is unable to synchronize with the heart's natural activity and consistently delivers a pacing stimulus at a present rate. Triggered: ability to deliver pacing stimuli in response to sensing a cardiac event. Capture function: electrical capture is indicated by a P wave or QRS following a corresponding to a pacemaker spike. Mechanical capture of the ventricles is determined by palpable pulse corresponding to the electrical event. Clinical indications: symptomatic bradydysarrhythmias, symptomatic heart block, morbid to second degree heart block, complete heart block, bifascicular and trifascicular bundle branch blocks. Third one, prophylaxis after acute MI, dysarrhythmia and conduction defects, before or after cardiac surgery, during diagnostic testing, cardiac catheterization, electrophysiology studies, percutaneous transluminal coronary angioplasty PTCA, stress testing before permanent pacing. Fourth one, tachydysarrhythmias to break rapid rhythm disturbances. First one is supraventricular, second one is ventricular. Thank you.